Welcome back, everyone. My name is Sean Mullins, and welcome back to my channel, Concussed, Case Manage, and Post-Concussion Syndrome. Happy New Year, everyone. Today, we're going to be talking about light sensitivity, and I will explain in depth what are the causes of light sensitivity, or what is called photophobia, and what are some of the strategies we can do to live and cope when one is sensitive to light. For those who may not be in the know, the second most reported symptom patients report after a concussion is photophobia, which is light sensitivity. And we will find that many patients who sustain an injury due to light sensitivity will find that it can be very debilitating and can result in lost wages. Although most brain injuries heal over time, as I was reiterating before, patients can be left with permanent disability. Intolerance to light is one disability that is associated with post-concussion syndrome. That suggests 40% of those who sustain a concussion experience light-related sensitivity. Exposure to light at some level can trigger physical pain and can be a catalyst for social, emotional problems, and as I reiterated prior, can impact one's ability to compete in the open labor market. Mild traumatic brain injury and light sensitivity. A couple things to know about is photophobia is a neurological problem. It is not a vision problem. And what we're talking about here is the brain's inability for the brain and the eyes to communicate light signals. That's quite an interesting phenomenon. The research, in fact, strongly suggests and hypothesizes that light intolerance is one of the many functions that is damaged through what they call the dopaminergic effect. And this is a chemical imbalance that not only impairs the brain's ability to produce light signals, but also the neurological function of pleasure and pain. Mild traumatic brain injury and light sensitivity. Photophobia may be, in fact, damage and linked to trauma related to, we're looking at the eye and talking about the eye, and we have a picture here of the eye. We're looking at the retinal ganglion cells and their pathway through the optic nerve. I did my best to get a picture that will show you, in fact, where those retinal blood vessels are located and where that optic nerve is. Quite common for those who have sustained a concussion to have had some sort of damage on the optic nerve. In fact, this leads to, we're also talking about cortical injuries and ocular vasodilation or other dysfunctions in this specific pathways. So you can definitely see by this photo here what I'm discussing and what we're talking about when we are looking at where the damaged part of the eye is when one sustains a head injury. Mild traumatic brain injury and photophobia can be a root cause. and this could flare up such symptoms as headaches, eye pain, increased head pain, watery eyes, vertigo, dizziness, nausea, inflammation, and extensive eye blinking. The pain, in fact, can just make one crawl up into a ball, as well as the nausea. And you could become so nauseous that it really will just impact your ability to want to stay in a dark place and be socially isolated. And I'll talk more about that during the course of our presentation. For the treating healthcare professionals, it is important to be savvy, and this kind of segues what I was going to here. With the emotional problems associated with photophobia, light intolerance can trigger the following: depression, irritability, aggression, mood swings, and hopelessness. So I can't emphasize this enough. If there's any healthcare professionals who are listening to my channel right now, that they really take mind and really, when they're evaluating their patients, really give considerations to evaluate these emotional problems thoroughly before drawing any conclusion to their treatment plan. How to treat photophobia. Light intolerance can consume your cognitive reserve by increasing symptoms of fatigue and impacting the ability to concentrate and focus when attempting to complete a single task. When the brain is damaged, it's very important, and I have discussed this in the past with fatigue, that when the brain is damaged, what happens is your cognition spirals down much more quickly to recover when you're in physical pain, when you're focusing and struggling with light sensitivity. Maybe it could be tinnitus, sensitivity to sound. This is just another thing thrown in our way, so it is important to take note later on when I'm talking about interventions, that we pay attention to what's going on physically around us the best we can. If we don't, we will end up spiraling all the way down and definitely be fully blown and prevent us from doing anything. According to research, now I'll get back right into it. According to the research, fluorescent, flashing, and flickering lights are the most common for those who experience photophobia. In fact, the data is quite startling, as more than 80% of the patients who have light-related pain is triggered by either fluorescent, flashing, and flickering lights. And I'm going to delve way into my own personal experience. When I was originally sent back to work, on the very first day I was sent back, I mean, amongst the fact that I was not really getting the treatment that I should have been getting, because I didn't have providers in the know in treating post-concussion syndrome. Blistering pain on the side of my head, and struggling with these flashing lights that made me so nauseous. And I couldn't stop being so nauseous that my employer actually sent me home, and in turn I went back to the physician, and that just saved way and put me off work for a longer time on my first go around back to work. And I'll get more into that, some of my stories later on, and the next presentations coming up down the line. But yeah, it was so bad. The nausea was very clear to the naked eye at that point that I couldn't tolerate the workplace. Um, so anyway, let's get back to the next thing about to discuss here is sunlight, computer screens, cell phone screens, reflective glares can also trigger attacks. It is those flickering, glaring lights and fluorescent lights that are the most problematic, without a doubt. Where I worked at the time, they had these old flickering fluorescent lights, and it was bloody murder. I mean, um, I was confined to a dark room that didn't really work for the employer and wasn't a practical way to manage um, my condition. Um, I didn't get the right treatment, as I said, for many months later. But that's something I'll discuss down the line. Mild traumatic brain injury, how to walk through. Okay, folks, um, the precision tinted glasses. This is the most effective treatment, especially with an FL-41 lens, as they block the fluorescent and harsh lighting. And these are available for purchase. They're, in fact, reasonably priced on a site that sells them called theraspecs.com. Many different styles and types for whichever would spark anybody's interest per se. The next treatment is this dark room, which I was discussing earlier. This is an antiquated approach to treatment. The most updated research has concluded dark room treatment is a risk definitely for depression, social isolation, and secondly, it actually worsens the photophobia because you're actually adapting to this harsh, the dark indoor room, then all of a sudden you're going to the indoors. So this is really having an impact and more so will flare up your condition when your eye's trying to adapt to photophobia more often than not. So very old method of treatment. The next one, just kind of an off-the-shelf treatment, but it's Botox injections. Commonly, most of us have heard of this for cosmetic treatment, but this has been proven to benefit patients who experience photophobia, primarily associated with migraines and neurological medical related conditions. The next form of treatment that is available is called an anti-CGRP. This is an injectable medication, and the goal for this medication is to target a protein in the brain called calcitonin gene-related peptide. And this has been the link for symptomatic pain. The research has concluded that CGRP does not lower the frequency of headaches, but will help tone down the symptoms, especially those associated with migraines due to light intolerance. The side effects are quite startling. If you're already having issues with anxiety and depression, definitely not a good treatment because this medication injection, you run the risk of increased anxiety and depression. And the other side effects are constipation, diarrhea, and of course pain and soreness around the site, which is as most common for most injections. And you can throw Botox into that too. The next form of treatment is called triptans, and this is used to treat a moderate to severe headaches by stopping migraines. They reduce symptoms such as pain, nausea, and photophobia. What the triptans do is they actually stimulate a neurotransmitter called serotonin. And by stimulating this neurotransmitter, which again, I'll repeat, is serotonin. It reduces one, inflammation, and two, constricted blood vessels. Uh, for healthcare providers, the literature concludes that triptans are not a appropriate treatment for post-traumatic headaches. That's very important to note. The side effects are fatigue and dizziness, which is also a contraindication for any patient who has sustained a cognitive impairment secondary to post-concussion syndrome or a traumatic or mild traumatic brain injury. The next one that they discuss, and this is quite interesting, is what they call TENS, transcutaneous electrical nerve stimulation. And this is a form of what they call neuromodulation, and this sends electrical current to the brain via the surface of the skin. The goal of this treatment is to activate what they call the trigeminal nerve, which is believed to be one of the pathways for light-related pain. Unfortunately, there's not many case studies that have been facilitated enough to evaluate the overall benefits of use for TENS for treating photophobia. It is important for a physician or physical therapist to direct a patient with pad placement. The wrong pad placement and trying to do that yourself can cause increased pain and spasms. So we certainly don't want to flare up our symptoms. And I'll emphasize that the pad placement needs to be directed by a physician, specialist, or physical therapist. If you're a patient, this is the pathway to transformation. To one, get a diagnosis. Two, seek out a specialist, a neuro-ophthalmologist, and get a thorough evaluation of your symptoms. Be your own advocate, or if your caregiver or your family is there in support of you, have them talk to your treating specialist, to treating physician, to find a neuro-ophthalmologist that knows light sensitivity and is in the know with mild traumatic brain injury or traumatic brain injury too, as well. It's important that you are referred to a neuro-ophthalmologist who is in the know with these symptoms and who's up to date on the literature, research, and treatment, or that'll just take you off in a wrong direction, and it's just a waste of everyone's time, to be very blunt about it. Identify the source of aggravation. What is triggering your symptoms? Is it flashing lights? Is it fluorescent lights? Is it the sun? Which it's, as I say, most of it is indoor lighting, without a doubt. Fluorescent lights can be the worst for many of us. Store lighting, what triggers those symptoms, and observe for any emotional complications. Do you see yourself crying more? Are you more isolated from others more than usual? Where has this photophobia, what path has this photophobia taken you on your overall emotional well-being? And with that being said, mild traumatic brain injury, it's important to know that photophobia is a lifelong condition. I'm going to be very clear. It may get better with time, or it may not. Photophobia can lead one down the path of emotional pain, as many of the symptoms are not seen by the naked eye. It is a matter of staying positive and using the assistive devices by your physician or specialist. When I mean assistive devices, I mean the special glasses with those orange lenses, the f1-4 ones, available on their specs. I have no special interest with this group. I'm just telling you from my own experience, these glasses have helped me, and I just want to help other people. I have nothing to do with this company, except for the fact that I've used their products and they've helped me, and to give them a trial because they may help you as well. So we stay positive. We want to try to stay positive and use our assisted devices as I will indicate. Walking at wounded injuries such as photophobia is one of the many, many injuries that are associated with post-concussion syndrome. And you can see that by watching additional shows on my channel, purchasing my book, Mild Traumatic Brain Injury Playbook for patients, physicians, and caregivers, available on Amazon.com. I've already, I lowered the prices as low as I can go. So it's fairly reasonable in price. I went as low as I could go on it. It's just a matter of getting the word out to help others, in my mind. I strongly encourage the patients who are feeling depressed or anxious to seek help of a licensed psychologist who specializes in mild traumatic brain injury, a psychologist or counselor, not a psychiatrist. And one that also, that could help is one that specializes in cognitive behavior therapy. That's an excellent start. Where to go to find such a specialist, I would say, is the Brain Injury Association of America. Many of them have local chapters where you reside out in your states and cities and counties. But in an event they do not, I provided a link for the website. And I hope this was a good resource for all you out there that have sustained an injury with photophobia. If you have any questions, comments, please feel free to drop me a line. Thank you.